Serving all of San Diego, this is your Fox 5 News.
There's always new research that we like to talk about with Dr. Goldstein here. We're tackling your most troubling sex problems this morning. Dr. Irwin Goldstein, editor-in-chief of the Journal of Sexual Medicine and director of sexual medicine at Alvarado Hospital, joins us this morning with ways to improve your sex life in this new year. Happy New Year, by the way, Doctor.
Happy New Year to you. Thank you again for doing this. It's always greatly appreciated.
Of course, and I'm assuming kids are in school, but if they're in the room, just for like a few minutes, get them out. Yes? Okay. Now that that's there. Number one, we have several topics to go over to improve your sex life in the new year. Number one, low libido in women. What do we do about this?
So just to take 2 steps backwards, this is the New Year's resolution time, and people are resolving themselves to lose weight, to have in part to have a better sexual life because they look better to their partner. So another resolution would be to resolve sexual problems. We have about 30 million human beings in the United States with sexual problems, and they sort of put their head in the sand and don't want to deal with it. So for women who have sexual problems, the most common sexual problem, according to the new research, is low interest.
Low libido?
We've always sort of made low interest a psychologic issue, and there are clearly psychologic issues, but we're now resolving that there are biologic reasons. And if we have biologic issues involved, like genetic predispositions, hormonal issues, neurologic issues, that means we can have drugs to help them, because we can try and match the drug to the biologic problem. And now we're doing clinical trials. So we have clinical trials for each of these 4 issues that we're going to talk about. And if anyone is interested in being involved, they not only would help the field, but they would help themselves, and they actually get financial reward for being involved.
There you go. That's pretty good. Okay, let's talk about women are, this is your information here. Women often are not able to be satisfied because of issues that their partners have.
Right. So another resolution would be that if your sex life is sort of troubled, not because you have a sexual problem, but the person with whom you are in this relationship has a sexual problem, it's time to open up, be honest, and say, okay, it's time you get an evaluation. So you need to find for that person someone who's interested in sexual medicine, and to get an evaluation, because you know what's good for the goose is good for the gander in this field. That's what I'm saying. Without question.
Communication is so important, Doctor.
Absolutely.
Another topic here: performance issues for men. A lot of these seem to be kind of people are embarrassed. They don't want to talk about this, but we're trying to encourage communication. So performance issues for men, it happens.
Right. So the biggest performance issue is resolved traditionally by Viagra, Levitra, and Cialis, the drugs that are FDA approved for this problem. But again, there are men who take these medicines who still have performance issues. So we're doing clinical trials with new drugs that will help men improve their performance problems. And for those women who are not happy because their men are not performing well, women should encourage their men to get an evaluation.
Okay, this is something that not a lot of folks talk about, pain issues. You guys study this, that women may experience some, I guess, discomfort in the bedroom.
Yes, so that's a huge problem, and it's one of the most common things we see, because you can't fake the performance when it hurts. I mean, if it's burning or raw or tender or feels like glass, it's just not a very, it's very distracting. And again, it hurts the partner when the person's having pain. But it could be that the woman's having pain. It could be that the man is having pain too. So we have a new clinical trial. It's actually the first of its kind in the United States to study the pain problem, the discovered problem in women. And we're very excited by this study.
And that study is important because, like you said, the pain issues, you can't really hide that as much as you can probably hide some of the other issues, but when it hurts, it hurts.
Yeah, so a lot of people think, again, it's psychologic, it's an abuse problem or something, and a bad experience, but it can be tissue damage, tissue inflammation, tissue irritation, for which this drug would really help.
And you're saying that there's clinical trials. If folks want to get involved, what do they have to do?
So Well, to get involved in San Diego Sexual Medicine, let's just call our facility. Claudia is the person who would address. So we have clinical trials for those. We have clinical trials also for an important problem when men are so excited that they end the performance early. So we have new drugs for that too. And that's also quite disturbing to the partner when that happens.
For more information, Dr. Goldstein, always with really, really great information. San Diego Sexual Medicine, Alvarado Hospital. If you would like to get in contact with the good doctor, go to our website, fox5sandiego.com. Click the See On tab. All the info is right there on your screen as well. Dr. Goldstein, as always,
Happy New Year to you,
Happy
Raul.
New Year to you as well. Thank you, sir.